Welcome to the Medical Files. I'm your investigator, and today we're opening our first case file from medicine's darkest archives. This is case file number 001, Medieval Surgery, the Age of Agony. What you're about to hear may disturb you, but these are the stories that shaped modern medicine through unimaginable suffering. Imagine this. It's 1347. You're a merchant in London, and a heavy cart has crushed your leg. The bone is shattered, protruding through the skin. You're bleeding, screaming, and there's only one option left: surgery. But this isn't the sterile operating room you might imagine. This is medieval surgery, and survival is unlikely. The man approaching you isn't even a doctor. He's a barber. Yes, the same person who cuts hair and shaves beards also performs surgery. His tools, the same razor he used on the last customer's beard. His training, maybe he watched another barber surgeon work once or twice. Welcome to an age when surgery was a death sentence disguised as medicine. Here's our first shocking revelation. In medieval Europe, actual physicians considered surgery beneath them. They were scholars who studied ancient texts and theorized about the body's humors. The dirty work of cutting flesh, that was left to barbers. These barber surgeons learned their trade through apprenticeship, basically watching and copying. No medical school, no anatomy classes, no understanding of infection or proper technique, just sharp tools and desperate patience. The iconic red and white barber pole, those colors represent blood and bandages. It was literally advertising surgical services. But here's where it gets truly horrifying. These men performed everything from tooth extraction to amputations to trepanation, drilling holes in people's skulls. And they did it all with the same basic tools: knives, saws, and occasionally hot irons. The nightmare of surgery without anesthesia. Now, let me describe what a typical surgery looked like. Remember our merchant with the crushed leg? Here's what happened to him. First, he's dragged to the barber surgeon's shop. There are no painkillers, no anesthesia. The best they can offer is wine or opium if he's wealthy enough. Most patients get nothing but a leather strap to bite down on. The barber surgeon examines the leg. His conclusion? Amputation. The bone is too damaged to save. 4 strong men hold the merchant down. The barber surgeon takes his bone saw, the same tool used by carpenters, and begins cutting through skin, muscle, and bone. The patient is fully conscious, screaming, often passing out from pain. The entire procedure takes maybe 10 minutes. Speed is everything, because patients often die from shock before the surgery is finished. No precision, no careful technique, just brutal efficiency. But here's the truly horrifying part. This was considered merciful. The alternative was watching gangrene slowly consume the entire leg, leading to an agonizing death over weeks. Let's examine the tools these barber surgeons used. What we found in the historical record is disturbing. Bone saws designed for carpentry, knives sharpened on any available stone, forceps made by local blacksmiths, hot irons for cauterizing wounds, basically primitive branding tools heated in open fires. Sterilization didn't exist. The same tools were used on multiple patients without cleaning. Blood from previous surgeries was considered normal, even beneficial in some twisted medical theories. For trepanation, drilling holes in skulls to release evil spirits or bad humors, they used what amounted to carpenter's drill bits. Patients often died from brain damage or infection, but those who survived were considered miracle cures. So how did we escape this nightmare? The transformation didn't happen overnight. The Renaissance brought new knowledge. Physicians began dissecting human corpses, learning actual anatomy instead of relying on ancient theories. The printing press spread accurate medical information, but the real revolution came much later. Anesthesia in the 1840s, antiseptic surgery in the 1860s, and antibiotics in the 1920s. These three innovations transformed surgery from a death sentence into genuine medicine. Case file 001 is now closed, but this is just the beginning of unveiling medicine's dark past. Medieval surgery reveals how far we've come and how much suffering was endured to get here. Every time you receive anesthesia for even minor surgery, remember, you're experiencing a miracle that medieval patients could never imagine. This has been the Medical Files. Subscribe for more information into medicine's most shocking historical mysteries. Until next time, be grateful for modern medicine, because you've just witnessed the alternative.